Well, hello, welcome back to the channel. In this video, we're going to explain Medicare and Social Security for 2022. So I hope you enjoyed this video, and if you like this video, please give it a like, comment, and share. All right, so let's go ahead and get started with Medicare Explained 2022. You definitely want to grab yourself a cup of tea and take notes. So who is Life and Med? We are an independent agency founded in 2020. We are an agency that is dedicated to helping people understanding Medicare and what all goes with it. We are unbiased, meaning that we represent all of the available options for Medicare coverage, and we never charge a fee for our services. We use a three-step process to help guide you. First, we educate you so that way you understand your choices, your options. Then we give personal guidance and we make recommendations based on your situation. And we also are your point of contact. So we give year-round service if you have questions, concerns. Instead of calling a 1-800 number waiting on hold, you contact us directly and we answer your questions and we help you with situations that may come about. So this is our three-step process. Just a little bit about me. I am a registered nurse. My name is Patricia St. Louis. I am also a Medicare agent. I have over 15 years in healthcare, working in skilled nursing facilities with expert knowledge in Medicare. So that's just a little bit about who I am. I have a question for you. Are you confused about Medicare? If the answer is yes, well, you're not alone. Many people are just simply not prepared to make Medicare decisions. And the problem gets worse when you get those flooded calls, emails, and letters once you reach the age of 65. 82% of seniors had no idea how to sign up for Medicare on their own. 50% of 64-year-olds will rely on someone else to help them pick the best plan. 30% believe Medicare costs the same for everyone, and 40% will not review their plans annually. In this presentation, we will teach you what you need to know before you make your Medicare decisions. Today, you will learn how and when to enroll in Medicare, what Medicare covers and its costs, what are the holes in Medicare and how to fill them, how Medicare Supplements, Medicare Advantage plans, and drug plans work and how they're different, how to make Medicare work for you in the best possible way. So how do you get your Medicare card? Your time frame to sign up is 7 months. If you're already collecting Social Security, you would get it automatically in the mail. If not, you must apply. You can go online to apply, or you can call Social Security and set up an appointment via phone. That's how they're doing the appointments right now until they do open the Social Security office. So let's talk about your initial enrollment period, also known as your IEP. This is when you're turning 65. So you have 3 months before your birthday to enroll in Medicare. You have the month of your birth month, and you have 3 months after you turn 65 to enroll to avoid a delay in starting your Medicare. So Medicare will begin on the first day of your birth month if you apply in the first 3 months. If you were born on the first day of the month, like July the 1st, then it will start the month prior. If you delay enrollment in the last 3 months, you can delay the start of your Medicare. So I do recommend that you enroll in Medicare 3 months prior to your 65th birthday. Do you have to go on Medicare if you're still working? Not necessarily. You can choose to stay on your company's plan if your employer has over 20 employees. You will not be penalized and can go on Medicare Part A and B later. Now, I do recommend that you go ahead and enroll in Part A. Okay, so that way you are in the system. So if you choose to continue to work past 65, and after that, say you stop working and you don't have insurance coverage anymore, then there are two things that you need to send to Social Security so that way you can apply for Part B. So you need to send over the employment request form and a CMS form, and the form number is 40B, and this forms will help you enroll in Medicare Part B, and it will show that you had employment coverage. If you did not have employment coverage, you can be penalized, and you are penalized for the rest of your life. So we want to avoid that, okay? So if you do enroll later and you use these two forms, your enrollment period would be January the 1st to March 31st, which is the general enrollment period. It would no longer be your initial enrollment period, which is IEP. If you do decide to use the general enrollment period, your Medicare coverage will start July the 1st. Quick recap. So if you're turning 65, you work for a company that has health insurance and you continue to work for them after the age of 65, you can delay Part B. What you want to do is go ahead and apply for Part A. When you're no longer working and you're not getting health insurance anymore, you want to go ahead and fill out those two forms, send them to Social Security so that way you can get your Part B and you can show proof that you did have insurance through your job, okay? So there are four parts of Medicare. Part A is going to cover your inpatient hospital stays, care in a skilled nursing facility, hospice, and it's also going to cover some home health care. Now, Part B is going to cover your doctor services, outpatient care, medical supplies, and preventative services. And Part C is going to be your Medicare Advantage plans. We're going to talk about that. And Part D is your prescription drug coverage. So let's talk about the cost of Medicare. So the cost of Medicare without a Medicare supplement or a Medicare Advantage plan. So this is original Medicare with no supplement added to it or a Medicare Advantage. So the premium is $0. So I won't call this premium free. There's no premium because you earned it. If you worked in the US for 40 quarters or 10 years and paid Medicare taxes, there's no monthly premium. Like we said, it covers hospitalization, skilled nursing care, home health, and hospice. So per 60-day period, you have a deductible if you enter the hospital of $1,556. Now, there's no cap to this. There's no limit. So like I said, it's a 60-day period. So say you go into the hospital twice that year and it's a 60-day break, then you have to pay another deductible of $1,556. Days 61 to 90, you're paying $389 per day. From days 91 to 150, you're paying $778 per day. In a skilled nursing facilities, from days 21 to 100, you're paying $194.50 per day. The first 20 days, there's no cost. And days 101 and beyond, you're responsible for all costs. The cost of Part B. So we already said that Part B covers doctor visits, outpatient services, medical tests, durable medical equipment, ambulance, medical treatments, medically necessary services, and preventative. The monthly standard premium is $170.10 in 2022. And that is based on a chart called IRMA, and we'll go over the chart. So if you are a couple making $182,000 or less, you pay the monthly standard premium. If you are a single person making $91,000 or less, you pay the standard premium. High earners will pay more for Part B, up to $578.30 per month, and up to $77.90 extra per month for Part D. You also pay a $233 annual deductible. Medicare pays 80% and leaves you behind with 20%, and that is without a limit, that is without a cap. So that could be very devastating. Paying 20% of a bill, paying 20% for a medical bill can wipe out your savings. So we want to show you how to bridge the gap. So this is the IRMA chart, which stands for Income Related Monthly Adjustment Amount. This chart determines how much you would pay for your Part B premium, and it goes based on your income the prior 2 years. So we talked about the cost of Part A and we talked about the cost of Part B. Now we're going to talk about Part C, which is Medicare Advantage, also known as a Medicare replacement. You need to have Part A and Part B to get a Medicare Advantage, which is Part C. There are county and region specific, okay? They have networks, so they have HMOs, PPOs, and also D-SNP plans. With a D-SNP, you have to have Medicare and also have Medicaid. Now, the monthly premiums do vary depending on your state. Some states, you have a lot of monthly premiums are $0 per month, and some states you will have a monthly premium. So it just depends on the state and the options that are in your area. So you have your Part D drug coverage, and they are required by Medicare. So you do have to have a Part D drug coverage. If not, you will be penalized. There are two ways to get a Medicare drug plan, which is a Medicare Advantage plan or a standalone drug plan. So there are different premiums and different plans. So the premium starts at $7 per month. Now these drugs are in different tier levels, and the higher the tier, the more you would pay for your medications. So what you want to do is look at what medications you're on, and that determines the best plan for your case scenario, because different plans cover different medications and cover the cost differently as well. Please keep in mind that if you do not enroll in Part B or Part D when you're supposed to, you will be penalized, and the penalty is a lifetime fees. It's not a one-time fee. The penalties are lifetime, every single month for the rest of your life. So here are some of the things that you should know. Not all doctors accept Medicare, so make sure your doctor takes Medicare assignment. Medicare does not cover everything. It does not cover long-term care or assisted living. There are holes in Medicare coverage costs, which can be very serious. So Medicare, like we said before, pays 80% and leaves you behind 20% after you paid the deductibles that we discussed earlier. Drug plans and Advantage plans change every year. So you want to look at these plans between October 15th and December 7th to determine if you would like to make a change from your current plan. Traditional Medicare Parts A and B does not have extra benefits such as dental, routine vision, and hearing coverage. But there are standalone plans out there. You can't stay on COBRA longer than 8 months. COBRA is not considered employer coverage. You can't contribute to your HSA while on Medicare. Timing is everything, so let's talk about your Medicare options. So there are two options, Original Medicare or Medicare Advantage. So with the Original Medicare, you would have Medicare Part A and B. You would add a Medicare Supplement plan, also known as Medigap. And you will also add a Part D plan for your prescription drug coverage. So the supplement will help you cover the gap. Like I said, Original Medicare covers 80%, and the supplement is going to cover the remaining 20%. Now, with a drug plan, you can get a drug plan starting at $7 per month. Now, let's talk about the second option, which is Medicare Advantage. A Medicare Advantage replaces Original Medicare. You will still have Original Medicare, but now you will have a card from a private insurance company. Instead of using your red, white, and blue card, you will use your insurance card, which is your Medicare Advantage. Like I said, Medicare Advantage is Part C, and you want a Medicare Advantage plan that includes a drug plan. So those are your two options, original Medicare or a Medicare Advantage plan. Let's dive a little deeper. So no plan fits all. Let's talk about the Medicare supplement. The Medicare supplement will have a higher monthly premium, but you don't have to worry about copays. The premiums may increase each year. You are prepaying, so you are paying every single month a monthly premium for your healthcare. So you're going to not just pay your Part B premium, you're also going to pay a premium for your Medicare supplement. No referrals are necessary. Some routine services are not included, such as vision, dental, and hearing. It is covered anywhere in the United States as long as the doctor takes Medicare assignment. Now, I must say, in the past few years, there are a few clinics that only take Medicare Advantage plans. For the most part, most doctors that take Medicare assignment takes Medicare supplements, okay? Now, the drug plan is separate, so you do need a standalone drug plan. Now, with a Medicare Advantage plan, you will usually have a lower monthly premium than a Medicare supplement. Depending on where you are in the United States, your monthly premium may even be $0 per month, but you will have copays. You pay as you go. I like to call these plans pay as you go. Now, you will have a network of doctors. So you may have a HMO plan or a PPO plan or a DSNP like we said before. You may need a referral to see a specialist. Many of these plans will have extra benefits. Drug plans are usually included. You cannot travel with your Medicare Advantage plans. Now, if you decide to travel and you do need to go see a doctor and it's an emergency, you can use it for emergency services only. Now, if you decide to move to another state, you will have to change your plan to a plan that is covered within that new state. Medicare supplement plans, there are different types of plans with different coverages, labeled A through N. The most popular plan is Plan G. I would say the next most popular is Plan N. Plan G has no copays and pays the full 20% that Medicare doesn't cover. You pay the Medicare annual deductible of $233 each year. All plans with the same letter are identical except for the price. There are no health questions if you enroll in the first 6 months of Medicare. They allow you to see doctors that takes Medicare. So if a doctor takes a Medicare assignment, then most likely they will take your Medicare supplement. Now, there are some clinics that only take Medicare Advantage, and these clinics have popped around in the last year or so. When shopping for a Medicare supplement, remember that it doesn't matter where you get the supplement from as far as the actual coverage, it will all be the same. So Company 1 Plan G would be the same exact thing as Company 4 Plan G. Remember that we said that the only difference is the actual price. Why is this important? You don't want to go with a plan with a very low initial price only to find out a year later that they jack up the price really high. This is where we can help you. We have the data of the companies that have a steady rate increase. So you want to be careful. You don't want to, get a supplement from a company that's going to lure you in with a very low price, then jack it up the following year or 2 years later. This is very important because in the beginning, there are no health questions if you get the Medicare supplement when you initially are eligible for Medicare. Say you get a supplement with a very low price, and let's say a year or two later, you cannot afford the supplement. Now you have to go through health questions. If you're not healthy at that time, you would not be able to change your supplement plan. Now, when you're looking at Medicare Advantage plans, these are not comparing it apple to apple. These plans will vary from state to state, even county to county. Now let's look at this chart as an example. So Plan 1, the monthly premium is $0. Plan 2, the monthly premium is $19. With Plan 1, the primary care physician visit is $0 copay. Plan 2, the copay is $15. With Plan 1, the specialist is $20. With Plan 2, the specialist is $40. So you can see that it will vary from plan to plan. Your copays would be different. The cost of the x-rays would be different. The cost of emergency visit would be different. The cost of number of days in the hospital will also be different. So you definitely want to sit down and compare the plans because, like I said, you're not comparing apples to apples. How do you decide on a plan? Well, ask yourself these questions. How important it is that you keep your own doctors. With the Medicare supplement, there are no doctor networks that you have to follow. Do you live in the city or in the country? If you live in this country, there probably are less Advantage plans to choose from, which means less doctor networks. Do you take several medications? So it's very important to really shop those drug plans. How important are low premiums and extra benefits? Do you want the flexibility of choosing doctors versus having extra benefits such as dental, hearing, routine vision, transportation, over-the-counter medications, and health club memberships that a lot of Medicare Advantage plans offer? So those are some of the questions you can ask yourself so that way you determine whether you want a supplement or a Medicare Advantage plan. What you should look for in a Medicare agent and what Life and Med offers. We partnered with over 20 different insurance companies, all the top insurance companies that offer supplements and Medicare Advantage plans to help you choose the plan that best fits your needs. We are non-biased, independent agents specializing in Medicare. We provide personalized guidance and education, yearly reviews. We offer services at no additional cost, client-specific plan research. We are your ongoing and Medicare and healthcare resource. We want to be your first point of contact. So we would be more than happy to assist you with your Medicare options and Medicare needs. Please feel free to contact us at 321-655-6022. You can also email us at helpmeagentpatricia@gmail.com, and our website is lifeandmed.com. Thank you so much for watching this video, and I will see you on the next video.